All right, I'm about to show you how to do our hip internal rotation in our 90-90 position. All you need for this exercise is you are going to need like a yoga block, but it could be anything that you can place in between your knee to help you maintain that alignment of your knee. You just want the knee to be set just wide enough, but in line with your hip, not too wide where it's outside of your hip. And of course, we don't want too narrow where the knees are actually touching. 90-90 position is essentially laying on your back, and you want your hips bent so that the knee is just right above the hip and the knees are bent about 90 degrees. We're going to take that yoga block, we're going to place it in between the knee. You're just going to squeeze it just hard enough where you don't drop the block, but you don't have to go out of your way to squeeze really hard. As with all of our exercises, you want to make sure that you're keeping your core engaged. And then you can go ahead and rest your feet like on the wall. So what you're going to do is core is engaged. So remember, we want a nice kind of firmness without any bulging in the lower abdominals. And you're going to rotate that foot out while keeping the block in its position. As you're rotating out, you want to make sure that your pelvis isn't rocking all over the place. And you also want to make sure that as you're rotating out, you don't want to feel that your pelvis is sliding up like you're doing a little crunch, because then now we're not really rotating the hip, you're just doing a little bit of a side crunch, and that's not the purpose of this exercise. So again, ribs flat against the floor, core engaged, and you're going to rotate that leg out to work on hip internal rotation. After you do the prescribed number of repetitions for one side, of course, you're going to have to do the other. So beginners, rest your feet up on the wall so that you can at least have some support. For more advanced, you're going to have your feet hovering. So that, again, is our hip internal rotation in that 90-90 position.